essentially focusing on isolated assessment. The patient's otherwise been assessed with their primary survey. There's no other locus of injury, so we're focusing in on an isolated left upper limb injury, both to assess is it serious or time critical, and what we can do to improve the patient journey from here on, how we can make them feel better and make sure that we contribute to their overall welfare. So is this injury time critical? Well, it all comes down to a neurovascular assessment. Is there anything that needs relocated? A wound that needs to be dealt with? Is there a fracture that's actually obstructing circulation? So how are we going to assess that? Well, it's all about distal circulation. So bilateral pulse checks to feel for equality, bilateral capillary refill, and bilateral assessment of colour, and then a brief bilateral neurovascular assessment looking for actual sensation. And if you could do a bit of distal movement for us. Fantastic. Okay, feels the same both sides.
Yeah. Grand.
Okay, now I'm going to introduce you to the upper limb assessment, which is the push-ow assessment. So starting with sternoclavicular joint and working our way along the clavicle, the AC joint, over the humeral head, front and back, moving down the humerus, to the elbow joint, again front and back, radial and ulnar side, working our way down radius, working our way down ulnar, coming down to the carpus, focusing particularly on scaphoid, and then coming into the hand and digits. So if at any point there you pick up bony tenderness, then this is a fracture until proven otherwise. If you've got bony tenderness plus obvious deformity in an otherwise unopen injury, then this is a potential dislocation. And an easy way of making that assessment firmer is to look at the opposing limb and see if you've got an obvious discrepancy between the two. Now, the treatment for all of these things is analgesia, reassurance, and splintage. And the best form of splintage, because it fits handily in one's pocket, and because it treats all of these injuries to some extent or other, is the triangular bandage. So real basic first aid, but makes a real difference for these patients. Keeps it out of sight, out of mind, stops them moving it around unnecessarily. With that reduction in movement, no matter where the injury is, they're going to have some level of analgesia. So application of that triangular bandage. Here we have something that's been in the pocket for a little while. We can see that it is a recognizable triangle, and we think the injury is somewhere between clavicle and wrist. So we know the problem's on this side, so we're going to point to the problem on that side. If I can bring this under here, let's see, and bring this tucked up underneath. And one part round the back, one part over the front. If I bring this up into a position of rest and comfort for you, tie, very simple knot at the back, ideally with a collar, but if not, just being wary that you don't catch hair or skin. Okay, and let you bring some weight down into that. Okay, reasonable position of rest, and if I can then spiral this into a very simple loop and tuck. Drop your weight into that. Okay. That a wee bit further. So, Alicia, you have a wrist injury. How's that feel?
Marvellous.
Okay.
I feel much better.
Okay, excellent. Alicia, you have a radial head injury. How's that feel?
Surprisingly, much better.
Okay. Looks like you've got a proximal humerus, maybe neck of humerus injury. How's that feel?
My goodness, it's much better.
Okay, excellent. I think you had actually dislocated here. How's that feel?
Great Scott, much better.
Okay, and I can't help noticing as the water laps around my knees that you've got a clavicle fracture there. How's that feeling?
That's much better.
Okay, excellent. So take home points, neurovascular assessment to define time critical or not, looking for any obvious wounds or deformity to define potential dislocation or correctable fracture that needs intervention, and then finally coming down to a simple bit of splintage, simple immobilization, and hence simple analgesia.